I'm Paul Preston. I'm a family doctor at North Bay Regional Health Centre and Chief of the Department of Family Practice here. The Patch for Patch program is a system where the pharmacists ensure that when patients who are on the fentanyl patch get a prescription, that they return the patch to make sure it doesn't wander off to unintended uses. So I brought the idea from Pat Klish and the people who generated it to my department to get feedback and see what people thought, what the docs thought, problem shoot it, and we needed a couple of modifications to the plan because people that were abusing them were finding a little loophole kind of a thing, so we had to write exactly which pharmacy because they were taking the prescriptions down to other communities like Barrie to get them filled because our licenses work across the province. So that was the first little refinement we had to make, that we had to write down at which pharmacy, so that so block that sort of just taking it down Highway 11 to get it filled kind of a thing. So as you can imagine, the docs were just thrilled about this, jumping right on board, and I think it's been great. So, and the docs love it. There's no hesitation. We just write patch for patch on the fentanyl prescriptions and which pharmacy is to be filled at. And so it wasn't a big ask of the docs, and the docs were, really wanting something like this. It's amazing what happens when different healthcare sectors like pharmacy and family doctors work together, actually, instead of in separate little silos. You know what I mean? And if we can build a system where that happens more on a regular basis, then we can address all kinds of problems that could be solved. And I have a number in my head right now, but there's currently no forum to do that. But anyway, the Pat Klish and her crew sort of generated this forum to bring us together with the police as well, and the magic happened. Well, the North Bay Regional Health Centre is just provided the structure to distribute the information to the GPs, because the other thing, without a current system in primary care, there's no way of sort of distributing it and contacting it and getting feedback, that sort of thing. So the hospital actually provided the structure to help make this happen with the doctors. And of course, they cooperate in all kinds of fashions, keeping record of who's showing up and emerge with this kind of problem, or in if they survive and get to the hospital, or if they get to the intensive care unit where we are today. Well, what didn't work is when we didn't write down the name of the pharmacy they were filling it, and the ones who had ulterior motives were just whipping down to Barrie and getting it filled. What's worked is cooperating. Interestingly, when we proposed it to all the pharmacies were on board, except for one, who was a chain that will go unnamed, because when we pointed out that this is going to be interesting, when we announced that everybody's cooperating except you, somebody higher up decided to agree. So what worked was everybody agreeing, everybody wanting the same thing, and I think the results are starting to speak for themselves. It's really worked, and it's really saved some kids' lives. I want to see this go across the country, spread across the province first, obviously. I want to see the drug companies that produce these things to do one step further, which is to put a serial number on them. Because right now, some of the people with ulterior motives are bringing back fake patches, which can be hard for the pharmacists to discern whether it's the patch that they had or not. But if it had a serial number, and they knew the serial number, that would eliminate that. So that would be the next step, to sort of get around the one last obstacle that I think they can do to get around this. And also perhaps somehow built into the serial number of the recognition system would be perhaps a provincial recognizer, so that my understanding from the police is that there is an influx from Montreal that comes to Ontario, and so if there's some way maybe of identifying that, the police would know better than me that might help us as well. And the other thing I want is to spread this kind of cooperation to other problems. So we integrate the system and we all work together. The reason the fentanyl patch problem is so different is because the drug is about 100 times more powerful than morphine. So I've talked to some kids whose friends died from this, and they said they just took one puff, knocked over dead, like that, because it's so potent, and they don't know what dose they're getting when they release it using vapors or smoking it. It's meant to be applied and gradually seep through the barrier of the skin over 3 days. They can smoke that 3-day dose. It's 100 times as strong as morphine in a breath. Bam, you're dead. That's why this is different. And that's why I think we had 14 or 16 deaths in our little community within a short period of time. And I think we've had none since this started. That's why this is different. It's very dangerous. Don't do this.